and welcome to one and all. I am Dr. Asawari Savant, Senior Sub-Editor of Elets Technomedia, and I welcome you all to very interesting another episode of Elets Innovation Talk. So this innovation talk is specially for the AI dialogue series that we are doing today. And on this pertinent theme, we have a very eminent speaker here with us, Mr. Ashraf Hussain, who is the Regional Sales Director of MEA region for Augnito India Private Limited. Sir, thank you so much for joining us. We are so glad to have you on the show.
Thank you so much, Dr. Ashwari, for being me here.
Great.
Thank you.
So on this topic of AI, which aligns with our upcoming summit as well, we have many questions for you. Let us start with the first one. Sir, can you please give a brief intro about your work into AI, how you are helping the entire organization, and how the organization is also working along the lines of AI and ML? Over to you, sir.
I would just start about myself. Thank you so much. I would just start regarding my career profile, and then I'll come to the AI. I'm into healthcare segment since last around 2 decades in this region, Middle East and Africa, and have seen in different phases of life here that AI is playing amazingly awesome role in healthcare when it comes to adoption and all. Okay. These days, especially when after COVID phase, when we all learn means how to be in the markets, off the line, and on the line available, not off the line here, and then taking care of the healthcare in the best possible ways.
Thank you so much, sir. And sir, can you also brief our audience, which is B2B specific audience, as to what all different areas Augnito is working in and how is it contributing to the wider audience?
If you talk about Augnito, we as a company, our parent company is ScribeTech, which has having 20 years of experience in clinical documentation, and we served with NHS UK for 20 years. And with that background, we came into this voice engine solutions. And last 4 years, when we commercialize our solution, Augnito Spectra, during these 4 years, we got more than around 500 hospitals, 22,000 clinicians are getting benefit out of it. So it is designed for 55 plus specialties of healthcare. However, initially, the pioneer in this domain were being used just for the radiology. But now as time is passing and we requires in every segments of the specialties of the healthcare. So our solutions is designed for 55 specialties. And the good thing is that we are being widely accepted, and doctors, the end users especially, they are getting benefit out of it.
Yes, sir, definitely. Amazing work has been done by the organization, and we hear about the latest developments and innovations that Augnito is doing every other day. So, coming with your vast background into this space since so many years, you have seen the transition from manual medical transcription to voice-based clinical documentation, and this entire shift. So can you please touch upon that, how this area has evolved, and now with the launch of predictive AI and all these latest technologies, how do you see in future this trajectory going?
Good. Earlier, especially if you talk about the radiology domain or any other domain where medical transcriptionists were used to work, they get to the voice downloaded, and then accordingly they are transcribing the things. It was very time consuming, manpower consuming. But things have changed now drastically, and with real-time speech-to-text solutions, means nowadays doctors burn out and their reports on times, all the clinical documentation quality is getting improved. So this is amazingly helping in healthcare. Now, when you talk about the say radiology only at the moment. Okay, they used to get it done by medical transcriptionist, okay, and in the other domain as well, discharge summary and all those things. But nowadays, with real-time speech-to-text solutions, exclusively as we are into market for Augnito Spectra, the time is not at all required. So means the doctor burnout time is gone, and they're getting things done on a real time basis. So it especially helps the healthcare providers, wherein if doctors in a day, if they're in a position to see say somewhere around 20 to 25 patients, with the same time frame, they can have at least 30-35 patients. So they are much in a position to see their patients in more numbers, and at the same time their clinical documentation is getting improved, which is required by regulatory bodies. And also it helps in insurance rejections, whereas most of the insurance rejections were coming out especially due to lack of medical indications being noted in the documents. But while they have to speak to, it's easy to speak than typing. So they are means speaking all the things, and the clinical documentation is getting improved, and so on. The insurance claims rejections rate has also gone down in the region. Adoption in this part of the world, when you talk about the GCC country and the Middle East and Africa, they always try to be the pioneer in this region globally. So they love to adopt the new technology, the new solutions, and that is how we are also focusing in this market as a primary market, and we are getting return out of it because end users are and their stakeholders both are getting amazing benefit from these artificial intelligence solutions in voice AI. Yeah.
So I have a few following questions on the information that you have shared with us. One of which being, as you extensively specialize in the Middle East Asia region, and you are saying that the adoption has been really good. So how does the adoption vary when we come to Middle East Asia regions of such technologies compared to that of India? If you can just help us broadly highlight, and also for India as well to adopt these technologies with the same speed and pace as Middle East Asia, what more is required according to your experience?
Few challenges is we are facing in these things, which always comes from the doctor's end. You being a doctor, you must be knowing it, that if it comes to adoption for a tech, it is very difficult for doctor to convince them because they are doing their own patient analysis and taking care of the patient, and they think of this is going to be additional time consuming. However, once they used to get of it, on that time it is easier for them, and they themselves says, it has made my life much easier. So sometimes it is doctors, sometimes it is stakeholders, wherein they might not be in a position to invest in these innovative things. This always comes, but once after getting convinced and they are ready to get it on their board, then it's fine. Then it's much easier. As per the UAE market or the GCC market, I can say it is amazing market, widely being accepted, the new innovations and all. But it comes to African market is again something like it is a little difficult. But India is also growing very fast. We have done a great penetration in the market. And I must thankful to all the radiologists and all the clinicians who are using our solutions in the Indian market. Almost all the major group hospitals, they are using our services. It will take time, but slowly everyone is going towards health tech, and they have to go. The only thing we have to think of is we have to let them learn on a frequent basis. We have to facilitate them. And that's how it is going to work in the system.
Thank you so much, sir. Very beautifully expressed. I couldn't have put it in any better words than those. So, for sure, yeah, after the COVID pandemic, we have been seeing that the clinicians are more and more open in India to adopting technologies and faster solutions. We have also seen post COVID that the potential that the country has in providing faster technological solutions at larger levels. So I am sure in future medicine and technology are going to work all together. And as you very rightly said, still some of the clinicians traditional practices that are doing traditional practices hesitate to adopting technologies, but more and more they are getting bombarded with the information all around them, and slowly getting over the resistance that earlier they were having. When it comes to such technologies, there is a vast aspect of regulatory compliance and data security that we have to consider. So, considering the stringent regulatory requirements in the health sector, what steps should healthcare organizations take to ensure the security and compliance of patient data when using such technology, such as the voice based clinical documentation systems? What do you have in your place, and what would you recommend for the our audience that is into the same space to follow?
This is very much most important concern you have raised about the data safety, because for patients it is much more important that their privacy shouldn't get revealed. So we as a company, we have international HIPAA certification for data safety. We have ISO certifieds, and almost all those who are into technology, they are taking care of the safety parts, because this is the first things what we believe in when we are into the healthcare. So data safety is taken care by. That is not at all any issues uh, nowadays. No, not at all. Yes.
Great.
You,
Moving on.
I think I missed more any part of the questions.
No, no, sir. That was perfect. So, HIPAA certification is one of the certifications that is globally recognized. Many Indian organizations also follow the same. But I have, read a few articles recently that India is also coming up with its own certification that would be nationally accepted. So, waiting for that to, get into processes so that Indian organizations can also have this standardization protocol, just like HIPAA is for the entire world. Coming on to another aspect, which is how do current market trends in the MENA region influence the adoption of voice recognition technologies in healthcare, and what competitive advantages does Augnito offer in this space?
Good. Uh, First, I will reply that certain part of your previous question I missed, the regulatory part, and then I'll come to your this part. Uh, in every countries, there are regulatory bodies in the healthcare and so on in the GCC region as well. So a regulatory body undoubtedly they plays a great role, because they have to take care of the healthcares, their patients, and their privacies. Once they have the international certifications for the data safety, they do not have any issues. The only thing is that as market is being segmented in two parts across the world, the government segment and the private. So in government, or what we usually they prefer is they prefer their own data, so like it is on-premise solutions rather than going for the cloud. Private hospitals, they go for the clouds. They don't have any issues. But the government, technically, it is as designed by the government frame. So they go for on-premise solution deployment, wherein their data safety is their own, because they have their own data servers like that. Now your next question is how the adoption is going to take place in the Middle East markets, and how the competitors are playing. Adoption is nowadays getting day by day improved. We as a Augnito, we believe in two very important things. One is we provide the solutions which is end users friendly. That is the most important things. Our end users, should be happy in using it, and it is absolutely user friendly solution. So this is one thing. And the second most important thing is that how they are going to get benefit of it, you know? So in adoptions, they are accepting it because time was in getting reduced. Clinical documentation, as I mentioned earlier, is getting improved. So adoption is going on in a much faster pace in this region than the any region of the world. They are accepting it. What was your second part of the questions? Other than adoption, market
Yes.
competitions. Yeah. So as in every segment, there is competition. So in voice AI solutions also, there is a huge competition. But the good thing is that, as I told earlier, these solutions was being used earlier mostly into the radiology domain. It was not being targeted in any other OPD departments or in the IPD, wherein there are doctors they are using in operation theaters, in discharge summaries. So I can say market is still virgin. We need to explore, okay, and that we are doing too. As our solutions is very user friendly, and we are promoting it to the entire specialty of the doctors. So, and at the same times, what we do is we give them a free trial also as a pilot project for all the specialties of at least one doctor in each specialties of that particular hospitals, and wherein they feel that yes, it is helping their life easier. It is helping their life easier, and so on. They love to get it on board. They themselves try to speak to their management. No, I need these solutions. So even though competition is there and competition is going to increase more and more day by day, but still there are so many evolvement is also going to come. So many innovations are also going to come. We are also working on innovations. So competition will always be there,
Definitely, sir.
but at the same
So,
times, if we are giving the right product to the right people at right time, it is being accepted. We are going to come out with one solution which we are already that is called Augnito Ambient. So this ambient solution is like it will capture multilingual doctor-patient conversations. Like you are the doctors, you are talking in like say any regional language, Tamil or Marathi, and I'm responding to you knowing a little language of knowledge of Marathi. I'm responding to you in English. So multilingually, or even Arabic or Urdu, whatsoever languages is, so it is getting transcribed, translated into English, and then with one click, it is going to be in HIMS of the patient, or EMR, electronically made EMR of the patient. So always there is innovations. Competition will be there. We should be focused on what best we are bringing to our end users. That is the most important thing, and that's what we are being accepted in a very fast pace in the region.
for
Yeah.
sure, sir. Augnito has been seen to be accepted very fast. Definitely, the credit goes to the amazing team, as well as the advancedness that Augnito adopts all the emerging technologies and latest innovations into this space. I am sure you will be able to relate. My father is also a doctor, so we have a medical background. So I remember him clearly telling me that there is also a profession for medical transcriptors, and the organizations are based in the parts of the world where it is day while it is night in India. So what they do is the day's transcriptions on the documents are transferred via email, etc., to parts of the world where it is night, so that in the in the 24-hour 12 hour break, you get transcriptions sent back. So with AI helping in this aspect with latest technologies, and with organizations such as Augnito working so tirelessly in this aspect. So much time of the doctors, the transcriptors, the entire medical fraternity is getting saved. So much more accuracy is being produced, and also the large amount of workforce can now be employed to some higher skilled tasks. These basic level transcriptions, etc., can be easily carried out by technology. So that is some amazing trajectory we are going on to. And now that you have shared that there would be a future of multilingual transcriptions as well, so definitely it is going to make the work of the entire process so seamless and so easy and fast for everybody, for the patient, for the doctors, for the hospital. So my next question is along the same lines. What would you see the future of voice technology going in healthcare? How do you envision the future of voice based clinical documentation evolving over the next decade, which is a very long time when we talk about AI and Gen AI? And what role do you see Augnito playing in shaping the future of this space?
Good. Uh, Voice AI is going to play a great role in futures. And now, when it comes to Augnito, as I mentioned, day in and day out, our product and engineering team, scientific team, they are working on innovations. You know, our co-founder and group CEO, he himself is very much dedicated in this things, and he always looks for the things. Sometimes I feel when we are going with a joint visit to meet the clients, and he loved to listen the requirements of the doctors, the requirement of the technicians, what they are looking for, and they try to implement in the things, in the solutions. So Augnito as a company, as I mentioned, when it is going to be, there are so many pilot projects are going on in the region across the globe for our Augnito ambient, that doctor-patient voice conversation. Can you believe, earlier doctor used to do like in a way they are typing on their desktops regarding the patient history, the informations, the diagnosis and all, and looking at the patients here and there like that. So it was not focus going on to the patients. Once this is going to happen, and this is already we have so many hospitals, they are asking for to buy it at the moment now, because pilot is going to near to complete and they are going to buy it for sure. So you can just imagine a doctor is going to give full focus to the patient, eye to eye contacts. He is interacting with the patients. So many personal questions also being asked during those conversations. Apart from the complete EMR record, what doctor wanted to be captured, like all the informations of the patients, and all this getting translated into English and transcribed in real time. And it will not capture those personal conversation. It will just capture the relevant things related to the healthcare to the patients, for the doctors, and being just with a one voice command or one click, it is going to be an EMR of the patient. So see how it's going to help the organizations. Time saving, clinical documentation improved, patients feel that I am being taken care of because eye to eye contact is there completely. So this is amazing, and there are so many more new products are going to come in coming decades. Because as you have rightly mentioned, from our early studenthood days, and as your father mentioned, it was medical transcription phase, and now see the things real time, everything's. So it's going to grow like anything. And the good thing is that we believe in innovations, and we believe in bringing the solutions which is going to be very much useful for the end users, and they're enjoying it.
For sure, sir. The entire model is very patient centric and very timely as as all these emerging technologies are being utilized into different spaces of digital health, this very aspect and to the depth that Augnito is going in this field is commendable. So we come down to the very last question of our discussion today, which is a little benefit, for us for having you. We would like to have your insights. So, sir, we have Elets India AI Summit coming up shortly, which is in alignment with the AI dialogue series that we are having today. So, if you were to be part of our panel, what kind of topics or what kind of subjects you would want us to delve into when it comes to AI in India, as we aim to position this forum as the premier forum for shaping India's AI future? What subjects would you want us to dive deep into?
Thank you so much, Dr. Ashwari. And first of all, I wish you all the best in your organization. Elets, you are doing commendable job in the region. I've been first attended your meetings. It was somewhere in Delhi, and that was a great event. Great event. Now your next questions. So definitely, as I'm in the field of now AI, healthcare AI, so my topic will remain the same, wherein I can share the most of the experience and how it's going to help out the stakeholders, the companies, the hospitals, the healthcare providers. So definitely it will remain the same topics for me. If you like to be me on board.
Yes, sir, for sure. But we would want to know that what topic should we include our summit that would be of interest to you and your, participants and your audience.
For sure, it is going to be like advancement of AI technology in healthcare, adoption, challenges, and how we are going to come out from all these things together as a stakeholder in the industry. So that's going to be a good topic for sure.
Sure, sir. I am sure the backend team is taking notes, and they will try to include as many points discussed today as possible. So, sir, we come down to the very end of our discussion. Thank you so much for joining us. We have Mr. Ashraf Hussain, Regional Sales Director of MEA region for Augnito India Private Limited. So, thank you so much for taking out time from your schedule and imparting us with wealth of knowledge and information on the subject of AI today. Thank you. We would also like to thank our audience for staying with us till the very end. Please stay tuned. We have more such interesting conversations around AI coming up. So, thank you for that. Sir,
Thank
would
you
you
so
like to
much.
say
Thank you so
any
much,
last
Dr.
remarks
Shavri,
before
for
we sign off the session?
thank you so much, Dr. Shavri, for having me here. It was indeed a great interaction, and I hope the listeners, the audience, the stakeholders would definitely love to go for the innovations, health tech innovations, and of course our voice AI solutions, Augnito Spectra, and the Augnito Ambient across the globes. So it is going to be amazingly helpful for them. And thank you so much, Elets. Thanks, Dr. Shavri. I wish you all the best for your future endeavors. To all of your team, thanks to all of your team. Thank
Thank
you.
you so much, sir.